Welcome to MedTalks, your go-to source for health information and medical insights. I'm your host, Juvenava, and we are bringing you the latest in healthcare. Whether you're looking to understand the basics of wellness, gain practical tips for everyday health, or learn about community resources available to help you live a healthier and happier life, MedTalks has you covered. Join us on this journey to better health, and remember, a healthier you starts with a single conversation. Stay informed, stay healthy with MedTalks, where every talk is a step towards a better you.
Grace Med Health Clinic is your home for complete compassionate care. From medical visits to vision screenings, dental care, behavioral health support, and a fully equipped pharmacy, we're here to meet all your health needs. Our dedicated team of providers and staff work together to make every visit welcoming and stress-free. Because at Grace Med, you're not just a patient, you're part of our family. Call 316-866-2000 to schedule your appointment. Grace Med Health Clinic, compassionate care for all.
Welcome back, guys, to another episode of MedTalks. I'm Juvenava, Director of Community Outreach and Communications at Grace Med Health Clinic, and I am here with the wonderful Jamie Morales of Sedgwick County Health Department. How are you, Jamie?
I am excellent. Hello.
Good. Hello. Thank you for joining us today. Jamie, tell me a little bit about your role at the health department. What's your title? What do you do?
Yeah, so I am the STI and HIV health educator for the Sedgwick County Health Department. And as the STI health educator, I go out into the community. I educate youth and adults on sexually transmitted infections.
Awesome.
So some days I am in the schools doing back-to-back presentations. Some days I am at outreach events with my booth and my prize wheel, handing out educational materials. Some days I am doing research on innovative ways to update our services, and some days I am, updating our statistics and our data because stuff is changing all the time.
I bet. And that has to be like a great experience to be out in the community, educating people about STIs and STDs and HIV.
Yes.
Can you tell me the difference between STIs and STDs?
Yeah, so STI stands for sexually transmitted infection, while STD stands for sexually transmitted disease. There was kind of a shift in terms to try and improve accuracy and reduce stigma. But STI, it only becomes a disease when it produces symptoms.
Okay.
So STDs develop from STIs.
Gotcha.
And infections, they will become a disease when they develop symptoms, but don't always develop symptoms.
Yeah.
So
that makes sense. Because I was definitely wondering why STIs versus STDs, but that does make a lot of sense. What are some of the misconceptions that you have dealt with when it comes to people having about STIs or HIV? There's
a lot of those out there.
Yeah, I bet.
I think some of the biggest ones that I hear probably have to do with symptoms. That people will know they have an STI because they're going to show symptoms, when in reality, the number one symptom of an STI is no symptom at all.
Right.
So another one definitely I hear a lot is that people don't have to worry about certain STIs because they're curable. They can take antibiotics and get rid of them. While that, to an extent is true, they're curable with antibiotics, certain ones. If they go untreated for too long, they can cause damage to the body and they can affect fertility. And in some cases, they can be fatal.
Yeah, no, I completely get that. I think sometimes people just assume that because there's medication, they don't really have to worry about it. That it's nothing that they really have to think about. What is the current landscape in Sedgwick County when it comes to STIs and HIV infections? What's happening here? Have you seen some recent trends?
Definitely. So we're kind of following, national and global trends where In the last 10 years, we've definitely seen a rise in STI infection rates. We have definitely seen major concerns with syphilis and congenital syphilis. There's really big issues there. Trend-wise, there are disproportionately, there are groups that are affected. For example, about half of all new sexually transmitted infections affect adolescents and young adults between the ages of 15 and 24.
Wow.
So, and we definitely see that here in Sedgwick County, especially among chlamydia and gonorrhea, which is really sad, that age group.
Right. Exactly.
So,
Why do you think that is? Why do you think it's affecting the younger population?
I think a lot of it does have to do, with education, with access to care,
Yeah.
with, condom use.
Right. Yeah.
So,
And I think, it has to be difficult sometimes in like the environment that we're in where people probably don't want to talk about those things.
yeah, absolutely.
Right. So how does Sedgwick County help in providing that education? What are some of the resources available that y'all have that could help have those difficult conversations, especially with teens?
So, definitely, I'm one of the resources. So, me being able to go out and do the presentations,
Yeah.
in the community, I will go out and talk to people and have conversations with people,
Yeah.
provide materials as well.
That's awesome.
And then we do offer, educational materials that we have on hand as well.
Yeah.
So,
Do you do those presentations in school settings or just mostly community events or things
so
like that?
anywhere and everywhere.
Okay.
I will go to schools. I will go to outside organizations.
Yeah.
So anyone who requests me.
Okay.
Yeah.
Awesome. So what do you think STIs, including HIV, are still? Why do you think they're still so stigmatized?
That's a good question. I think for so long that it has been ingrained in people that STIs were something dirty.
Yeah.
That if someone had one, they did something to deserve it, or they
Right.
did something bad to get it.
Yeah.
And that's so not true.
Right.
But
It's like no one wakes up and says like, "Hey, I'm gonna go get this." Right?
yeah,
Yeah.
exactly. But STIs, they're prevalent. They're here. They're
Right.
common. And while that's unfortunate, as a community, we need to normalize talking about them.
Yeah.
And we need to normalize educating about them and promote testing for them. And I think if we do that, we can break down some of those walls and some of that stigma.
Yeah. And I'm glad you mentioned that because I was going to ask you, like, what can we do as a community to help break that stigma? Like I said, obviously talking about it, being more accepting of like, how it comes from, not blaming people for getting it. So I think that's really important. I think, having these conversations are also very important to have. Do you feel as though, people are obviously scared to get tested? What do you think could be one of the barriers that people face when it comes to wanting to get tested for an STI or HIV?
I think fear is definitely huge.
Yeah.
And I think that comes in several different forms of fear. Fear of what people are going to think of them when they walk in to go get tested.
Right.
Fear of what goes on during the testing. Fear of privacy.
Yeah.
But also cost.
Right.
Cost is always going to be a huge barrier too.
Yeah. And I think that's the reason why I definitely wanted to have the discussion with you, because here at Grace Med, we see patients who are uninsured, who sometimes are concerned about the cost of getting those tests done.
Yeah.
And so community health centers like Grace Med, we do offer testing at a sliding fee, and also like resources just like Sedgwick County Health Department, in case they want to talk to someone or get any kind of referrals or education. And I think places like Grace Med and other community health centers are very important and vital for the community, especially when that fear of the cost for those testing
Absolutely.
is there. So we know, obviously, taking care of yourself and things like that. How can people protect themselves and their partners from STIs and HIV?
So, you know, ideally, partners would go get tested before entering into a sexually active relationship to make
Right.
sure they're negative for STIs or HIV,
Yeah.
and enter into a mutually monogamous relationship. But that does take trust and commitment. And so while that might not be in the works for everybody, condoms are going to be the best barrier for safer sex. But I do want to point out too that condoms are not 100% and they don't cover everything.
Yeah.
But they are the best barrier for safer sex.
Awesome. Now, I've seen a lot of commercials of this, like watching TV about PrEP. Can you talk to me a little bit about that? And how does PrEP work? Or how does that prevent HIV? What is that?
So PrEP is a medication that will help prevent HIV infection from occurring. And it is a medication that must be taken exactly as prescribed, and it can actually help to prevent HIV from sex by about 99%,
Okay.
or by injection drug use by at least 74%.
Right.
Like I said, it must be taken exactly as prescribed for it to be effective, though.
Yeah.
So,
And I'm glad you mentioned the drug usage because I feel as though people have a misconception that HIV can still, it's only by sex, right?
right.
But even with drug usage, can you go into a little bit more about that?
Yeah, so the blood contact through sharing needles or syringes or equipment that's used to inject drugs is another big way that HIV is spread.
Yeah.
So,
And I think we've seen this happen a lot in Sedgwick County with just the rise of drug usage, like meth and
Yes.
fentanyl and things like that, especially meth when you're shooting it, right?
Yes.
So that could be another concern that people should look out for, is that you also don't know what they're doing like on the weekends or in the evenings and things like
Absolutely.
that. So keep that in mind. Are there specific behaviors or symptoms that would indicate someone should get tested for an STI?
So, well, as I mentioned before, when it comes to symptoms, number one symptom is no symptom at all.
Yeah.
So I would say if someone is sexually active, they need to be getting tested.
Yeah.
And when I say sexually active, it's vaginal, anal, or oral sex. So,
Yeah. It's really important to definitely get tested.
yeah.
Yeah, no, I agree. What resources does Sedgwick County Health Department provide for people seeking testing or treatment for STIs and HIV?
So, resource-wise, we have this great, actually, I brought one with me.
Okay.
So, I love these little cards. I try to give these out as much as possible.
Yes.
So, these are these little general clinic service cards that we have.
Okay.
And they are one of my favorite resources that we have.
Yeah.
And I can hand that to you.
Of course.
So they kind of detail what our general clinic service offers, or the services they offer, and what we test for and treat for as far as STIs go. And if we are not the best fit for you for whatever reason,
Yeah.
there's a little QR code on the back, and you can scan the QR code, and it takes you to a link for a page on our website.
That's awesome.
And it takes you to a list of all the other clinics within Sedgwick County that offer testing services and all of their information, as well as if they offer PrEP and PEP.
Okay. That's awesome. That's a great little thing. Like it fits in your
Yes,
wallet.
it's really discreet.
Yeah,
and
it is.
yeah.
I love that. Like just looking at it right now, like it's, something that's foldable and you
Yeah.
can just open it and it lists all the resources and like ages and things like that, like health screenings, family planning. I love it. That's another thing I also wanted to ask. We were talking about how this is affecting our younger generation, like our teens.
Yes.
If teens want to get tested, do they have to bring a parent? How does that work?
So as long as they are at least 13, they do not need parental consent.
Okay.
So as far as state of Kansas,
Yeah.
13 and older do not need parental consent.
Okay.
It is encouraged.
Yeah.
Just so you can have that adult trusted adult support,
Right.
but is not legally
Okay.
needed.
That's good
So,
to know,
yeah.
especially for some teens who might be scared to get tested
Yes.
or even talk to their parents about that stuff, you know?
Yeah.
So, is there anything else I probably didn't touch on or anything that you wanted to mention to our audience before we stop?
Just, want to say that we're available for educational services for anyone that is interested, doing our best to try to reduce the spread of disease. So,
Awesome.
try.
And if someone wanted to reach you
Yeah.
or look into the resources, where should they go?
So on our website at sedgwickcounty.org, on the health department website, we actually have a request a speaker page, and they can go to that, and there is a place to request STI and HIV health education. So, and that will send us an email, and I can respond to that.
Awesome.
So,
Thank you so much, Jamie.
yeah.
Thanks to all of our listeners for listening to this episode. And again, if you need more information, go to sedgwickcounty.org and they will assist you with that.
Yeah.
Thank you so much. See you next time.
Thank you.